We haven't implemented yet. We already ordered them. We're expecting them any minute, but definitely it's a good idea, I think, to implement the infrared thermometers. Obviously, we know that there's been questionable things about, well, if it's hot outside and they come in, how accurate it's going to be. But I think it's better to be over cautious than not. So definitely something that we're not doing now, but could be implemented. We're also having them sign a consent, and this is something that I think Gianni has one of the pictures coming up later, where recently Dr. Bosom came up with a form in order to help also minimize our liability. Obviously, we're taking all of the precautions, but our concern is we don't want any patient to come back later and say, well, I got COVID from your office. And so that's something that we have a form that they fill out, that they're aware that obviously that there's always a possibility, there's a small risk that they could be exposed to COVID in the waiting area or anything like that, and that they understand that their exam is necessary and that they're willing to go through with it. Another thing that Gianni put down at the bottom, and I actually like this, that it's a possibility, would be to screen patients even before they come in. I think that would be, it's pretty amazing with the technology now, with the Ring doorbell, with the Nest doorbell, where you could technically speak to the patient and say, what is your name? What are you here for today? And kind of ensure that, that you're letting them in if they have an appointment. We're a paperless office, so we already are minimizing the amount of paperwork we have. But obviously there's fee slips that we're using, and that's something that only our, primarily the technicians and the front desk come into contact with them, and they're all, all clean and with gloves and everything protected, so I don't think it would be an issue. And I think that's about it for that. And this is our form that we've been giving out to our patients, just letting them know that.
I'm in on this. So we're gonna have whoever participated today in and sends me their email through chat and wants this, we're gonna be sending a consent form that's gonna be drawn up by an attorney that I know, and that way you could just put your logo on the top and use it and feel confident that at least you have something that acknowledges that we're doing everything you can, like Dr. Gonzalez and Dr. Bosom said. And we might put a part that says that the patient also acknowledges and attests that they aren't, that they are not having any symptoms. So that's another thing that we're going to go ahead and do for our members.
Perfect, nice. So that sexy doctor you see there that you can't recognize is me. But so essentially this is what we're doing. That's one of my technicians, Paula, she was very nice to sit for the picture. Is so as you see all the patients, wearing the mask. I have an eye shield that we're using. We're wearing, I kind of alternate. We've now, there shows the surgical mask. I've been using a KN95 and the N95. I think definitely that would be the most recommended mask to use. I use goggles, and so we're covering our, covering my head, and we use this one, and they have another soft one we use as well. The gloves obviously are closed. Obviously you don't have to, but we've been wearing scrubs, and we've been wearing our lab coats. Our lab coats obviously are either staying in the office or in our car in the heat. And then, as the moment we get home, or I'm literally coming in through the garage, and I'm, putting things in the washer, and not coming into the house with any of my clothes or my shoes. So essentially the other thing regarding the room is, before every single patient, we are wiping down the chairs, we're wiping down the slit lamp, any area where the patient's going to be coming in contact with. And then definitely all of our staff members, technicians, I said the front desk, and I'll go into that a little bit more detail later. They're also very much covered, head covered, goggles, masks. The breast shield is something that we implemented thanks to COVID. And it's incredible how I look back and I'm like, that we didn't have this before, just with simple colds and in the flu, obviously every year. So that's another, an added, wall to getting the patient to breathe on you. We put that area about making your own, because at the beginning we had a hard time getting them, or just took a while. So we use plastic folders, and we have one of our technicians kind of get an outline, and we use that too. And that was very good too. So regarding everything else, like the procedure of lensometry, all of the steps, like I said, we're wiping down the tonometers with alcohol, the phoropters, the ARs, so all of that. And obviously we're doing it ahead of time. and we're doing it in front of the patient. So they see too that you're taking this extra precaution. I think that's about it for that. And anything else, Gianna, you want to add to that?
I wanted to see if we could get some insight on your opinion on how you're doing tonometry, what you're doing for dilation, um, things of that nature, you know, procedures like gonio.
Okay.
Anything different?
So
Everything the same?
okay, so essentially, I think in that aspect, we haven't changed immensely because we've always been careful in that, like my gonio lens, I make sure I wipe it with alcohol before before I use it. Then I rinse it down with saline solution well, and then I use it. And once I'm done, I again use, alcohol to wipe it down. Same thing with the tonometers. We wipe it down and then I clean it off with the saline. Regarding the drops, obviously we have to be more careful because we have the same bottles. And if I have a bottle cap fall, or obviously if it happened to touch, I would throw that bottle away. If, I wouldn't reuse it. But essentially, I'm just trying to minimize, if I'm using one glove to hold the lid, I'm touching with the other, I'm putting the drop with the other hand so it's not touching them. So essentially all of that, the gloves, I'm using the same gloves with the patient because obviously, we're wiping everything down. But sometimes in between, if I did a little extra touch, I'll get a kind of pump on the alcohol thing we have, and I'll wipe down my hands, continue, and then obviously remove my gloves and throw them out after I finish with the patient.
And then you have someone go and clean all the slit lamp, and because you're wearing the glove while you're touching the patient and the slit lamp at the same time. So you then have
Correct.
someone, after you finish your procedure, come in and clean your handle where where you change pressures and magnification and stuff like that.
I have a
Exactly.
couple of comments.
Yes.
Number one, when you want to do fluoresce, use the fluorescein strips, and that will have bottle to strip coming out of a sterile package, as opposed to a risk of touching the bottle to the eye. Then you can take the strip, apply it to the eye, toss it in the garbage. So that's one. The second is in the dilating drops, you just want to go a little farther away and drop it in, lean the patient back and drop it in the eye. Yesterday, there was a paper, I believe, out of Israel showing that there is definitely virus in the conjunctiva that's been published. So we definitely want to be on our best behavior. But all these cases of EKC that we've had through our career, I think all of these techniques we should carry on long after COVID, because we used to go through the EKC protocol and clean the room. But if you had an EKC that you didn't know about, you could be transmitting basically the common cold virus and causing a similar problem, but with less major morbidity and mortality, but still passing it along. The second comment I had was, I don't know how much people want to know about the different masks, but I have samples of, if you could put me on the full screen, I can show a couple things here.
Ooh, I don't know how to do that. Barbara, can you see if you could put them on the full screen?
Can everybody see me?
Mhm.
Okay. So what I have here is, can you see the number on there? It says KN95. Does everybody see that? Okay. If you notice, there's a metal piece at the top. When one applies a mask that's this style, as you can see, I have a goatee, but this will go around it. If you have facial hair for the men all the way over here, you basically defeat the purpose. The goatee's okay. For the women, no facial hair, you're fine. But the idea behind these masks is creating a seal around your nose and mouth to the point of sealing at the top, and then there's a fit all the way around. And now you don't hear me nearly as well. And when I breathe, this opens and closes like a valve. So this is one style here. That's a KN95. That's the Chinese version of N95. Here is more or less a painter's mask. It has a valve. It's a little easier to breathe. And it also has the same top piece. Whenever you put these on, you want to make sure you press all the way at the top along the bridge, and it goes all the way around. Otherwise, your N95 mask is not really an N95 mask if you're allowing air to come around the side. Now, these are two versions of different kind of masks. This is a nice mask as far as easier to wear, has a valve in it, and then it has a place to put these 2.5 filters. So this is a step down from, if you can see, it says PM 2.5, and that's a step down from the KN95, but this filters the same amount of air. It just doesn't seal. It also has metal inside this top part. Hopefully everybody can see that. And then on the inside, the filter has a pocket, and hopefully you can see that. And the filter goes into the pocket and it does its filtration. It's a little better than a surgical mask, which I'll show you next. So these are some surgical masks, and the difference between the N95, KN95, or FFP2 and 3 is those are all stopping everything up to 2.5, and 95% of the particles are stopped. And these are more about 80% and probably not stopping corona. However, they are stopping all of, or a good portion of the air filled with fluid that can go out. So one of the other things we talked about before is that front desk staff. If the front desk is seated and the client or patient walks in and they're standing, that front desk is in a danger zone because the air droplets go out and then down over 6 feet. So you don't want to be out and down from the breath of somebody for sure. The patient having one of these is going to stop a lot of that breath, but not all of it. So that's all I have to say about masks. Hopefully that helps. If anybody wants a more detailed explanation, we can certainly, one by one, you can call us, we can FaceTime with you and teach you how to don the masks.
Nice. Okay, so I just wanted to briefly show what we're doing, like our staff, that those are our technicians, and we're just making sure that obviously they can wear the gloves properly, and we recommend, we don't, we're not inspecting them, but we recommend that they have their nails short, their hair is pulled up and all into like a bun, so they can wear the hats. They're all wearing surgical masks. Some of them are wearing N or KN95, but at least we're making sure that they're wearing the surgical ones, and definitely the protective eye shield. As I said afterwards as well, for myself, we're doing the gloves, the protective eyewear. Something that I want to try, I was talking to Dr. Boson this week, is I want to get one of the other shields, like the face shield. I'm myself having some issues with, like, even though I've tried to kind of clean my goggles and stuff like that, I'm having issues with it fogging over. And so that is an uncomfortable thing for me that I'm experiencing. Like, my lenses are fogging up, and then the slit lamp, and then on the other side with the patient also, their mask is fogging up my 78 or my 90. So something that I've been doing, since some of them are wearing soft masks, is I've been holding down the top part of their mask with my finger while I have the lens in. And that way, that helps kind of prevent some of that moisture or hot air getting up. So that's helped a little bit with not their side fogging. So I'm hoping by trying one of those face shields, that probably will help me from having, less fogging on my end. Any questions on that? Anything else? So this is a view of our Pembroke Pines office, and so we just spacing out the chairs a little bit more. Another view of our breath shield that we've been putting in all the rooms.
Dr. Gonzalez, what do you do when a patient refuses to wear a mask or removes a mask during a portion of their visit?
So first of all, and like I said before, we haven't had a patient refuse to wear them. I think that in my case, I would not feel comfortable seeing them if they don't want to wear one. I would say, look, this is for your safety. And unfortunately, this is our protocol. We wouldn't be able to see you. It's funny, but I've had some patients actually ask me, when they're going to get up on the slit lamp, oh, do I take off my mask? I'm like, no, please keep it on. This is definitely the time to keep it on. Or they're wearing it too low. They're exposing their nose, not covering. So I'll just simply say, please raise your mask. Please, I need you to wear your mask. And they've been fine about it. The other thing is speaking. Some of them are used to speaking to you while they're on the slit lamp. And so I'll pull away what I've been doing. It just happened today, this morning, where I pulled away from the slit and said, can you please, give me a few minutes. Let me finish up my exam. I'll answer your questions in just a moment. Or please don't speak right now. Let me finish up the exam. And so, I'm definitely more aware of not having them speak while they're behind the slit lamp. So this is Dr. Bosem's part.
Okay. You guys ready for me now?
Yes.
I changed my background to show you what Dr. Gonzalez was saying with the math. Hopefully you can see that. Okay, so where are we now? Okay, so how is Correct Vision keeping our patients and your patients safe? And how are we doing that? Let me go back to my other background. And okay, there we go. Okay, so what are we doing? Cataract surgery, we are already practicing all these techniques. The patient comes in, the patient is seen, they're lying down. Everybody in the room is already wearing a mask in order to be in the operating room. So we haven't really changed much. The patient's lying down, they're not being intubated. So there's not a lot of respiratory secretions coming towards us. It's not something that you want to actually have the patient masked while they're lying down having surgery. We're going to have a nasal cannula in their nose, but it's mostly things going into the patient as in oxygen and air, and not so much coming out. They're covered completely, and just the eye is exposed during the cataract surgery itself. We are contemplating whether or not we want to test for immunity, meaning prior infection or active infection. Unfortunately, the tests are snapshots in time. So at some point in time, we have to go through and treat this as though the patient will give us a history and we'll be able to find that out. And then LASIK is about the same. So in LASIK, the patient is not masked. The doctors and the staff in the room are all masked. Our protocol for the office part of things is exactly as Dr. Gonzalez described. So I don't think we're going to change. The only thing we may add is a surgical mask for the patient lying down. And I have to test that out on my first few times doing LASIK surgery, just to see how the patient does with having a mask while they're going through LASIK. I don't think they'll have a problem. So we're probably going to start with a surgical style mask, which is very easy to breathe. If people have tried to wear the N95, the KN95, or the FFP2, you'll notice that you feel restricted. You feel a little bit claustrophobic, and it's a little bit harder to breathe. So we do want to be conscious of that. I think when we go into surgery, we're going to have to just change our mentality a little bit. I want to be wearing that one of those higher level masks if I'm going to be doing surgery. LASIK, we have a plume evacuator, which will stop any viral particles that potentially could be in the stroma. That's probably not too likely. But just in case there is something that gets all of that out. We are starting both LASIK and cataract surgery in May. It's looking like May 1st, we are going to be doing LASIK, and May 5th, we're going to be doing cataract surgery. One of my colleagues in San Antonio, Texas, was today doing his first surgeries back in the office. He posted it on Facebook. He treated actually a first responder. And it goes back to what Dr. Gonzalez spoke about before, patient with mask and goggles and glasses, fogging up, and they were just so annoyed that they finally wanted a surgical vision correction in order to continue working. Once again, safest way, if you're out in the field, you are a first responder, you need to have some sort of eye protection, even if you had LASIK, even if you have contact lenses. If you wear glasses, you have a partial covering, but not a complete covering. Combination of glasses and wraparound safety glasses can cause some fogging issues. So I think we're definitely going to be going ahead around the 1st of May or soon after and starting back up, back to the real world, baby steps, high level of care, but we're going to be taking care of people who've been waiting patiently to have it done. We're here, I don't know if anyone's here out of the state of Florida, but according to the conferences over the last few days, the hospitals have more rooms, more equipment than they need. Anesthesia machines are being returned to our surgery center, and there's plenty of personal protective equipment, or PPE. So we can, next slide.
Actually, I wanted to ask you a few questions that we,
Submit your application
what
during
type of gloves do you recommend?
get a link and email to resubmit your application at this
So
location.
are you talking exam gloves or during a procedure?
For exams.
So just the nitrile gloves are fine. The gloves in this particular instance are more for protecting the doctor and the medical staff. The gloves are actually PPE. We can do an eye exam where we wash our hands, we take care of the patient, we wash our hands again, and it's not going to be any different than wearing a pair of gloves, taking the gloves off, putting a new pair of gloves. The difference is if you're wearing a pair of gloves, you're going to be throwing that out. You have one extra layer of protection. So I think that it is smart to wear gloves, but there are certain things where your tactile sensation is not as good with gloves. So I think that's a personal decision. I think the most important thing is hand washing and keeping your hands away from your face. One of the beautiful things about the mask is it reminds you all day long not to touch your face. So I don't know, as I'm watching here, I haven't seen too many people touching their face, but we're all doing it all the time. And that's what causes this virus to get in, is touching your eyes, touching your face, touching your mouth, and at least I say touching your nose.
I'm going to go to the next slide. So I'm going to go ahead and I'm going to ask you some questions, Dr. Bozen. So, you know, I know one of the hot commodities right now is hand sanitizer, and, you know, it's like the toilet paper, it just disappeared. So I started going on a hunt, and luckily I went to your last dinner and found a bottle of hand sanitizer that you guys gave me. And that was my survival kit for like the first week of this pandemic. Then on the next picture, that is not beer. Okay, that is actual hand sanitizer. A lot of the brewery companies are actually using the leftovers and making hand sanitizer for people and giving it away for free. I know a lot of people have gotten creative and made homemade hand sanitizer, or used like the Young Living oils called Thieves for hand sanitizer and disinfectant. And then you have your normal Purell. All of us right now, I'm gonna share resources at the end where to get some of these items, but all of us right now are wondering, are we using the right techniques to clean the tonometer? Should we be cleaning tonometer with alcohol? How long? Should we be doing NCT instead? So can you talk a little bit about disinfecting and doing tonometry?
Okay, so I would say the Goldman tonometer, whether you disinfect it or not, you're going to be contacting the tear fluid, and then you're going to be swinging that tonometer arm around, and there could be some droplets as you swing it around coming right towards you, coming into the room, flying onto surfaces in the room, on the table, the slit lamp. So the Goldman is probably the least safe of the techniques. I would be of the opinion that a tono pen with a little latex cover is going to be safe. And it's just like a glove touching something, and you're just going to throw away the glove at the end of that procedure. And then the NCT blowing the puff of air to where the machine is more or less blocking that air from coming back. So the air, I'm not an NCT expert, but my observation is the air gets blown out and it's the pressure coming back that's measured. So most of that air coming back is coming right back at the machine. What I don't know is how that gets cleaned in between.
Right.
So that's the part I'm not too sure of. I don't own a CT. I don't have one in the office. We talked about this last week, and as I think about it, I really think the tono pen is probably not the most accurate, but the safest. We've also decreased our use of checking tonometry from doing every exam, every person, to looking at new patients and our glaucoma patients and our treated with steroid patients, and then our post-ops, and not doing every single time, every single patient checking their pressure. I don't know that it's that necessary. Obviously, we all fall into vision. Pressure is like part of a routine exam, but you don't need to do it on every single exam unless there's a reason.
Okay. Thank you. And if we were to use our tonometer, you soak it for 5 minutes, right? In alcohol?
You want to, okay, as long as alcohol kills, just like you're cleaning your hand with Purell, alcohol kills, and alcohol exposed, it doesn't have to be that long, but if it's long enough and the alcohol needs to be dried off completely. We've all, myself included, have been super aggressive about alcohol in a tonometer, and then super quick about coming back and then having that Pac-Man feeling when you caused a circular abrasion on a cornea due to chemical. So you don't want to do that. So we got to be very careful that it's dry afterward. But I would probably avoid, I would really avoid the Goldman unless you have no other choice.
Okay. Well, thank you. I really appreciate it. I'm going to go ahead and talk about the optical. There's some people here that may have to deal with the optical and some that don't. But for those that you do, of course, I don't think we'll look this stylish in the next few months, because we'll be wearing masks and goggles and surgical hair covers. What I've been thinking of every step, every time we have to come near a patient, what can we do to limit our exposure? So one of the things is a lot of our autorefractors have a PD measure inside of the reading. It's not always accurate, but one, you could use, if it's established patient, you could use their old PD instead of remeasuring it, or you could use your autorefractor reading. If not, we could go about talking about what the staff should wear, but I am going to follow the guidelines that I've been researching, and most of my staff is going to be wearing probably a surgical mask and a face shield. So in reality, if they're wearing a face shield and the patient's wearing a mask, I think it's okay for them to get a seg height if they need to for a moment. Do you agree, Dr. Bozen, that that's okay for them to do if they're wearing a mask and a face shield and the patient's wearing a mask too, to go ahead and get a seg height where you just get like within 1 or 2 feet to mark the patient's glasses?
I think that if the patient's wearing a mask, this is all about risk management. So I think we have to look at all universal precautions as risk management. So when we went through this as a country, they first said social distancing, and you don't need to wear masks. And that was somewhat of a, I don't want to say fraud, but what they were trying to do was reserve the masks for the hospitals just in case. And then when they realized that they could ramp up production, then all of a sudden they switched gears and said, wear masks. We were about 2, 3 weeks ahead of the curve. I started ordering masks from Amazon at that time because I saw from Asia that it's really, the mask is as important as the 6 feet, because the mask actually probably reduces the 6 feet to a lower number. You just don't know what that lower number is. If you get closer than 6 feet, you have to feel that you have some chance of catching something. Okay. But if the patient is masked, your chance is way lower. Um, if the patient has an N95 mask, that's helping them. If they have a surgical, and if they have a surgical mask, it's probably helping the technician or doctor, and not really the patient, but they're keeping their own aerosol to themselves for the most part. So it's all a matter of risk avoidance and limit the time. I don't know if anyone saw that recent, did anyone see the interview from the mayor of Las Vegas on CNN? But they had a picture of a restaurant in China, and they showed how one person in the restaurant infected all these people. Well, that one person was within 6 feet of several people, but no mask. If you did the same experiment with masks, you probably wouldn't infect anybody, but you might infect one. So I think we still have to be careful.
Right. So one of the other options that I researched is a tool called Opticam. There's other companies that make this, but it's a handheld device that you give an iPad to a patient, and they themselves kind of look in and it measures. I don't know the accuracy, but some people are looking into that. So that's also an option. Another point is when we're in the optical, a lot of us have very small dispensing tables because we have limited, real estate. So what I did was I got rid of some of my chairs and I made sure to sit the patient like pretty much, a few feet away from my staff. That way, when they're talking about money and options of glasses, they're a few feet away. That way it limits exposure. Also, you want to make sure that you create an environment where you could have one patient in the room at a time. So scheduling is really important. And that's why I say maybe when you first open up, scheduling very little to see how you could orchestrate that coordination in your office, that, while someone's coming in, someone's in the optical and they're not kind of crossing paths. The other thing that we don't think as much before, I used to always do lensometry, grab the patient's glasses, give them back to them, go on my day. Well, now when we do lensometry, remember that those glasses are plastic and metal and that's on their face. So that could have bacteria or a virus on it. So we have to think when we get those glasses from when we're pre-testing that patient, you want to grab those glasses and say, oh, let me go ahead and clean your glasses for you. And that's where you go ahead and you use a proper disinfecting solution. Some options are alcohol, but you have to be careful with coatings and certain frames. I ordered Pure and Clean spray. A lot of members on OD Facebook and different places use it, and I've been using it in my office. It works pretty good. Also, some people are using bins with water and soap. I think it's good for you to have a bin in the optical showing your patients that you have a tray that is a tray for disinfecting, like a cleaning area, so they know that you're taking precautions and they feel comfortable. Also, we are actually gonna offer shipping to all our patients and include it in our pricing. So when they go to the optical, it's free for us to deliver it to them, shipped. You may want to consider that, or you could also offer the patients to pay for it, or the option to drive up and pick it up curbside. A lot of us might have what's called Weave, and there's text services that you could text. The patient could text you when they arrive downstairs, and you could have a team member go and take the glasses to your car. Talk about VIP service. One thing that I think a lot of us don't think about, and I'm always very aware, is payment. When someone is giving you their credit card, I mean, you don't know where that credit card's been, how many other vendors touch that credit card. So I think it's important to find a protocol, whether your front desk is going to put on gloves, touch the credit card, take the payment, take off gloves, throw them away, or wash their hands when they take that credit card payment or cash. But they need to be aware that it's not the same anymore. We were also discussing contact lenses, and I was talking with Glenda, And you know, Glenda, she loves contacts, and she was talking to me about scleral lenses. Glenda, can you give us a quick, just a quick minute on what you're doing for your contact lens area? Can you unmute yourself? Well, okay, just in case she'll chime in if anything, but pretty much you have to consider now, you know, where you're going to do INR, how you're going to do it. Make sure your office and your table don't have a lot of things on it, papers, things that you have to clean afterwards, like decorative items or things to hold glasses. You want to make sure you have a very clean environment. Make sure that there's a sink close by, because hand sanitizer really, really hurts when you're doing INR. You want to make sure you don't have a community solution. I have a community solution and now I have to get rid of it, where we have like the little contact lens solution bottles and people forget their contact lens solution. Hey, can I borrow it? You want to offer annual supplies too. It's a great time to sell annuals so that they could get free shipping and they don't have to come back and get exposed. Not that, you know. Now, I'm going to go ahead and just share some quick links about supplies. So I know everybody right now is trying to find supplies. So I'm going to go ahead and send an email at the end with all the vendors that I have found that have supplies and are very economical. Some of them are kind of interesting. So these are the face shields. These are the different type of face shields that they are. There are some that are the first picture. I will be giving away to anybody that signs up for the chiasm. I'm going to be giving away 3 to 4 for each office that signs up. And if you're an existing member and you are active, meaning you use the portal either to chat, because there's a chat function, or you send a referral, you will also be getting these 4 shields, the first picture. I like those better than the second picture because the second picture is a little scary. And I think that we're in the field where we want to feel welcoming to our patients. The third picture I found is a disposable option for $1. I don't think they're going to be very comfortable, but if you don't want to have to deal with cleaning them and you want to just use them and throw them away, one of my box companies from my eye candy store is making them. The last picture I love. I tried to get us bulk discount. You could get actual faces of different animals to put on your shield. So if you're in pediatrics or if you want to just have a good day and make your staff feel like it's not so stressful environment, you could be a cat for the day, you could be a dog, you could be whatever you want on your face shield. Also, I don't know about you, but I want to look good while I'm working. So there is surgical caps. Dr. Pager went ahead and she found an Etsy shop that does them. Some of them are running out, but for us ladies that want to look stylish, there's nice surgical caps on Etsy. Also, Crocs, the shoe store, is giving away free pair to healthcare providers, doctors, but you have to log in and sign up before 12. They only give a certain amount per day. I have not been as lucky to get one, but I will try again tomorrow. Also, the brush shields. So Top Gun is giving a free brush shield. I'm going to show you mine. Okay. Now, I also found a local vendor in Dayton Broward called Prime Ophthalmics, and they service equipment, and they are giving you $10 off for this one. And I think it comes out to $32 or $34, but it's a big difference. And it is clear. This is a new one that they delivered to my house. I just haven't taken off the blue cover. So their information's there. Also, I wanted to point out the Optometry Diva shirt in the bottom. That shirt is, they're selling that shirt. It's a great organization of women that get together, and they're selling that shirt, and they're giving us, for every shirt they sell, they're going to give a face shield to a healthcare provider, a first responder. Now, these are other suppliers that I found. Discount Mugs actually has great supplies at a great rate. The PPE Supply House has N95s at a good price too. Some of these vendors have them and they go quick, so you have to be visiting their site more than one day. A lot of these vendors have gloves, so just follow Dr. Bozen's recommendation on the type of gloves. This bottom picture is something interesting that I was researching a month ago when we thought we were still going to be open. These are called cell phone lockers. So I was thinking if, you know, having a cell phone locker area outside where maybe a patient wanted to pick up after hours or not come into the area, they would put in a code that you text them and they could open their locker number and get their glasses out. They're not that cheap. They run between, I think, $700 to $2,000. But if, you know, in the future, if this becomes something we have to live with, I was just thinking of options that we might be able to incorporate into our practices. Also for mask. So I've been talking to people in New York, and a lot of doctors right now, because there's no N95s, are using the KN95s. If you want to know if it's real, if you want to know if it's a good one, there's a link there to the CDC website that lets you know if it's an FDA approved, CDC approved mask brand. So you know that you're buying something that's good and good quality. There is one of the vendors that sells frames, and she is providing these masks for $350. And if you are in Dade or Broward closer, she'll deliver them to you. If not, she could ship them to you. The last link there is an amazing website. Dr. Grover shared it with me this morning because he knew I was getting ready for this presentation. It has like another 10 sites of where to get supplies. So I will be emailing everybody this information. And I want to tell you, this morning I went to, and we're going to be finishing up soon and opening to answering any of your questions, but I wanted to share this with you. So this morning I had to go to the doctor's, and I do not have COVID or anything like that or any symptoms, but I had to go to the doctor's for something personal. And I felt very comfortable. They asked me to wear a mask. As soon as I got there, I had to go to the fourth floor. They had the door open for me. They had a person sitting there, very nice, with gloves, hand sanitizer. The thermometer that they use, you see how small that thermometer is? It's amazing. I don't know what brand it is. I went ahead and took a picture. They took my temperature and let me write up. I think that's gonna be the new norm. So if you have an elevator, you might want to think of having a stand downstairs and makes your patients feel while they're taking, really good measures. Dr. Gonzalez, if you want to go ahead and pick up from here.
So this is a letter that we received via email. I think it was last week, and it was from the FOA, and it was a letter that one of the FOA attorneys had sent to the Lockton Liability Insurance, and so saying about essentially how we were essential, we were an essential part of the society, and that obviously we still had the right to do, give medical care for patients that had emergencies, at urgent care. But even one of the things was saying full scope optometry. So we were on the brink of saying, well, is it okay to do a wellness appointment? But this goes back to, if they broke their glasses, if they're not seeing well, they can function. Obviously, that is something very important. And I think especially as things are going to be opening up and a lot of surgery centers are going to be opening up now in May, I think we will gradually be able to say, okay, this is a routine exam because the exam, glasses are necessary, and it will be okay as long as we take all of the precautions that are necessary.
So one of the things that you brought up in your presentation that you have here on your slide about the business interruptions coverage, we are going to be hosting another Zoom session Q&A next week on Tuesday at 2 o'clock. It's going to be out in the email with an attorney that is going to discuss if you qualify or not. A lot of people think they don't qualify for business interruption because they call their insurance and they say they don't. But there's a lot that we don't know about, and some of us may qualify. So if you have a private practice or your own practice and you want to come into that, it's going to be pretty short though, because there's not a lot to talk about, but we're going to be hosting that next week. I really want to thank you guys for discussing all this information with us. Dr. Gonzalez, Dr. Bozen, did you have anything else you wanted to add if you wanted to open it up for questions?
No, I wanted to thank everybody for coming out this afternoon, and I wanted to wish everybody to be safe, but to get back and practice vision care in the field that we love and take care of our patients. And let's get back to work, but do it in a safe and effective way. And I'm always available to discuss any private questions. If somebody has a question, I'll either give you an answer or maybe shoot you in the right direction.
So whoever needs to leave can leave, because I know it's been an hour and everybody has their days. If anybody wants to stay and ask a question to Dr. Bozen, Dr. Gonzalez, or myself, you could either unmute yourself and just ask, or you could send a chat directly to any of us, and we could go ahead and answer the questions for the group. We want to make sure everybody, any question you have might be a question someone else has, and it might help us be better doctors. So any questions? right. Okay, I want to thank everybody for participating. I want to remind you, if you want to get any of this information and I don't have your email on my email newsletter, go ahead and do that. If you want to sign up or have any questions signing up, you could also email me at info@thechiasm.com. As we grow as a group, we're gonna, really try to connect all our doctors, helping them co-manage, making sure you get your patient back, making sure you build that relationship and send your patient to the right doctors. I really am so happy to see everybody, and I'm optimistic and happy that pretty soon we'll all be practicing again and we're all going to be ready. So thank you all for joining. It was great seeing you. Thank you.
Thank you.
Happy,
Thank you.
Happy Earth Day.
Yeah, happy Earth Day. Plant a seed.
Thank you.
Thank you, Gianni.
Bye-bye.
Bye. Let me see if I have any chats. I'm just checking my chat to see. So I got from Tamara, make sure I have your email, Tamara, because I see that you sent me a message to send you the presentation. So just, I was wondering what this was.
Does anybody have any questions? I have a telemedicine visit I need to attend to at 3 o'clock, so.
I think you're good. I'm checking now the questions that I got, and I think we're good.
Okay, be well, everybody.
Thank you.
Hope to see everybody in person someday and not on a little postage stamp.
Also, I put that picture because it just shows that even despite what's going on, we try to have fun as staff and make the best of it. And then I'm sure we'll get through this. That little by little, it just helps us appreciate more what we do and helps us appreciate more our patients. So I think in the end, we learn from everything. We'll be
That's
okay.
yeah.
Mhm.
Okay,
Oh,
bye-bye.
yeah,
Bye. Thanks.
Bye.
Bye-bye.
Michelle, you still there?
No, I think she just got off.
Um,
I'm trying to save my chat.
on the chat. I'm still on the chat.
You just hit there's an X button, but that's okay. I'll be just writing down emails while everybody's here.